So I've always asked
And
you this question
anything,
about,
yeah, go on.
yeah, I've always asked you this question about infertility. That would it be right for us to say that it's on the increase, or that you've noticed a rise in it, or it's taking an upward climb, as it were? I don't know if I'll be right if I say that.
I guess you're right by saying that. We're just a little bit cautious about, because like in Nigeria, there are no strict data that you can follow
Okay.
on. But one thing that is obvious is that male infertility is climbing all over the world.
Okay.
There was a study that showed that sperm count has declined by about 50% in the last 40 years, all over the world. And the one we did in Nigeria, we saw that in 10 years, in my clinic, of course, that the sperm quality seems to have depreciated by 30%. So it's at like 3% every year. So there's no doubt that sperm count is taking a bashing for so many reasons. Our lifestyle, there's something, the environment that we're exposed to. So many things are happening to us that is making sperm count to go south. But the good thing again is that it's possible to treat most of these things. But it's better that we prevent them, so that, and that's why sometimes it's good that we have this kind of talk where people can, before these things really get out of hands, the things that you can do, because lifestyle is a very important component in fertility, either for the man or the woman. So if you know that you're yet to complete your family, there's some things you need to avoid. I mean, I seem to see that a lot of recreational drugs are on the increase in Nigeria now, all over the world. And that is actually a no-no with fertility. It reduces
I didn't get that.
fertility.
I didn't get
Recreational
that point, sir.
drugs. I said
Okay.
recreational drugs, yeah. They're on the increase all over the world among young people. But that also is a no-no with fertility. Smoking, cigarette smoking declines fertility in both the man and the woman. And then sedentary lifestyle that we live. You need to exercise, not strenuously, but light exercises would do. Keep a good body weight, and then eat healthy. Those are some of the things that we need to do. And for the men also, if you can avoid heat, excessive heat around your testes, that's also good for you. So I think most of it, no, heat. Hot, making the testes to become hot.
Okay.
So like people who long distance truck drivers, people talk about putting your laptop on your laps, things that will heat the area around where the testes are. That's why God put them outside the body. It's because He wants them to cool, and therefore also the kind of underwear that you wear, they're also very important. So lifestyle is actually the only one that we can handle, that is preventable.
Lifestyle.
And of course, yeah, lifestyle. And part of lifestyle again is age. If possible, start your family on time. If it is not, store your gametes, either your sperm or your eggs.
Okay, sir. Okay, sir. Sir, before a couple complains that they have infertility problem, how far would they have gone for them to qualify to say, okay, fine, we have a challenge on our hands?
Okay, thank you. Now, this is what is from statistics that we're able to look at this. That just like I was saying, that if a couple, when they don't have any problem at all, if 100 couples decide in a month that they want to have a child, they probably 25% of them will have a child. By the time this couple decide that in 6 months, about 55% of them will have a child. In 1 year, about 85% of them will have a child. So, and that's why we say that a couple needs to strive for about 1 year for us to be able to see that there's something wrong with them before we start subjecting them to tests. But we have had to modify that definition of infertility because of women who are over 35 years old. Because we know that there's something called a physiological clock that ticks, especially by the time you're over 35. So for them, we say after 6 months, you must start to investigate why you are not able to conceive. But for when you're less than 35, 1 year after that, after you've been trying, then you need to find out why the pregnancy is not staying.
Okay. So, sir, what will be the most appropriate definition of infertility now as we speak, since it's been reviewed over and over again?
Well, it's still the same. That is the inability of a couple to conceive after 1 year of trying. That is, they have regular, unprotected intercourse. Regular means they have intercourse 2 to 3 times in a week. Unprotected means that they are not using any form of contraception. But the modification is with the age of the woman. If she's 35 and above, then after 6 months, you can start ringing the alarm bell.
Sir, is it possible for a 55-year-old woman to have to conceive? Somebody asked me that.
Sure, it is possible for a 55-year-old woman to conceive, especially if she's using IVF, because as long as the good thing about, any technology, you just need to understand it. You can use it and you can abuse it. All right? For a woman, as long as you are healthy, you have a uterus, you can do IVF. The technology can be applied to you. But there was a couple in India that they hold the record of being the oldest couple in IVF. The woman was 70 when she had babies. Whilst they were celebrating the birth of the babies, the husband, who is 72, had a heart attack, was taken to the ICU. 2 days after, the new mother also joined him in the ICU. So the technologies can be used by, if you are healthy, 80-year-old. But the question to always ask is, whose interest is this? All right? You're going to bring another life into being. When a woman is already 70 when she's having a baby, yes, she could live for another 20 years and be 90, no doubt. But the problem is the quality of life of both the baby. I don't know. If you are 50 and you have a child, you have a toddler with you, you understand what I mean. How the amount of energy that you need when you tell a 3-year-old you are 50, sit down there, you need to see, you don't have the energy to train such a child. And so when you're 70 and you're trying to bring up a child, it's really a lot of work. And the quality of life of the child that you're going to bring up again. So people sometimes talk about the welfare of the child, okay? That what is the welfare of a child for a woman at 70 to have a newborn? Of course, we are not God, and nobody's trying to play God.
Yes, sir. What would be your message to a lot of women who are watching us? We have so many of them watching us now. What would be your message and advice to the women watching us?
Well, my message is always simple, and that is that there is hope. Okay, if you want to have a child, the times where infertility used to be it used to be like a curse is gone. You can always find treatment now, and you just need to do the right thing, follow your doctor's advice, and God will be with you.
Are we also making progress with the IVF technology in terms of how to bring down the cost? Because a lot of women also get scared of how much they need to spend on IVF and all of that. So I don't know if we're making progress in that regard, whether there are possibilities or whether there are options or things we can explore to help.
Yes, thank you. It's also a very nice question. But without being tricky, I will say to you, Sheye, that is there any way that we can bring down the cost of iPhone in Nigeria? We don't manufacture it, so we're not really in control. Most of the things that we use for IVF, if we want to do it properly, you see, it's like everybody wants to go to heaven, nobody wants to die. You want to have good quality, like what you have in the UK or in the US, and then you want it cheap. The two probably will not go together. I wish we could treat everybody, and the only way that can happen is if there is a subsidy, either there is an insurance or there is government. Somebody must be paying for it, all right? Because everything we use, okay, the dollar is flying away from us now, okay. The powder-free gloves, ordinary gloves, you have to import. Everything that you use, the catheters, everything that you use, the drugs, everything is imported. So the dollar has a big bearing on the kind of service we render. Now, IVF clinic is not a place where light can go for 2 minutes. So we know what the electricity supply in Nigeria is like. So there's some clinics like mine, we have 3 generators in each clinic. So the cost of rendering the service, apart from that, we have the NEPA, what do they call the thing that brings light into your house? The one that usually blows up in the area.
Okay.
Transformer. We have a transformer dedicated to the clinic. You have inverters, So sometimes and these are some of the things that if you are in the UK, you are in the US, you don't lose sleep about, So, and you still you are now also at the mercy of the foreign exchange again. So everything is, it's not easy for people also who want to measure up to the kind of standard that you get anywhere in the world. And what I tell people is that if you already have a business where you know that the success is about 40%, if you cut corners, then your success rate becomes about 20 or something like that. And then somebody who wants to do it, who can probably get pregnant once, we now have to do it 3 times. And then it's like being penny wise, pound foolish. So it's a big thing. It's a big problem for all of us. And we just wish that, like I tell some people that now, when the dollar was 165, it was a better business for me than what it is now, because we're just. Yeah, go on.
And what's your message to the male folk, the men?
Oh, one of the things I tell the men is that when you have infertility, please do not leave your wives alone. Go with them to the hospitals. Women, the way we are wired is different. The man is a logical being. The woman is an emotional being. The two balance each other. Now, if you allow only all decisions to be made from the emotional point of view, you might be missing a lot. If you allow only the decisions to be made from only a logical point of view, you might be missing a lot. That's why the way God wired us differently and put us together. So it's important for the men to follow their wives, to know exactly what they're doing, so that you can take decisions together. Because really and truly, the most important aspect of IVF treatment is decision making.
But how do you now deal with the ego aspect of the male folk?
Well, you see, men have egos, but we need to have reality checks all the time, right? Yeah, what does this involve? And then most of the clinics also who are experienced are used to some of the men who are really, and you know something I say about men is that men are, because they are logical beings, if you are not logical to them, they are funny. But once they can see that you're logical, what you're doing makes sense, they tend to also cooperate with you. So, and that's my experience with men. Once they see that what you are doing makes sense, then they tend to relax, and you can carry them along with you. And that's why I keep saying that they should always be there with their wives.
But sir, if you compare our lifestyle now with the lifestyle of our fathers and great grandfathers and all that, is it that their own lifestyle was slightly better or more amenable to fertility? I don't know how to put it. It's such a, or is it, I mean, is that the way we eat, everything is going wrong or is not appropriate and all that?
Well, you know, any disease, reporting also matters. And I can tell you what affects reporting sometimes is that people don't report a disease that you cannot help them with.
Okay.
So the more you find a cure to a disease, the more it seems to become more common, because many more people are going to come to the solution. All right. So I'm not sure that infertility was not with our forefathers and so on. You know, I think it was with them. But we also know that in those days, they had so many ways of dealing with infertility, some of which nobody wants to try this day and age. You know, especially in some areas of Nigeria, it's known that some young men are made to sleep with some women who are not their wives in order to reproduce the family line. But those things are not, they are unheard of now because of technology. So I think infertility had always been with us. It was even in the time of Abraham. So infertility had always been with us. So I think one of the things, yes, it might be increasing because of our lifestyle, just like we said, but definitely the fact that also people can be helped by the technology has made it also and that's why we can talk about it now.